Hi, everyone, and welcome to episode 118 of the Veterinary Behaviour Chat podcast. And I'm so delighted and so honoured to have with us today the amazing Dr. Kersti Seksel. Now, I am a little bit biased because Kersti was one of my residency mentors, and I had such a wonderful experience. But Kersti is also not just a boarded behaviorist, not a double boarded behaviorist, but a triple boarded behaviorist or specialist in veterinary behavior medicine. So she's a diplomate of the American College of Veterinary Behaviorists, the European College of Animal Welfare and Behavior Medicine, and she's also a fellow of the Australia-New Zealand College of Veterinary Scientists, which is the Australian equivalent of being board certified. Did I get that right, Kersti?
Absolutely perfect.
Perfect. So, Kersti, welcome. Thank you so much for joining me today. And I'm so looking forward to having this chat with you because you are one of the only people that I know who started veterinary behavior medicine before we reached the 2000s. Is that correct?
It is indeed. Yes, I was not the only pioneer, but I was the one in Australia that one of the two in Australia that kind of started pushing things along, and the first specialist in Australia. So
that's amazing. And I guess my first question, and we just kind of spoke before we started recording, I don't actually know the answer to this, even though we've spent so much time together and, you have been such an amazing mentor to me. I don't actually know how you got into behavior medicine or what it was that sparked your interest, especially, I guess, all those years ago when maybe behavior medicine wasn't so well known. I mean, it still is such a sort of still is a pioneering area within veterinary medicine. But what was it? Was there a case? Was it something that sparked your interest? How did you get into it?
Well, let's rewind. Why did I become a vet? That might help you understand. And episode 118 is kind of cute because I always say I have been doing this since last millennium, and I was probably about 17, 18 when I went to university. Why did I become a vet? Number one, I had no idea what I wanted to do. Zero idea. And I'm not one of these people who always want to be a vet. I always liked animals. I like being around them. But I never thought I would get enough marks to actually get into university. And unfortunately, or very fortunate, I should say, I got into university. And in those days, you kind of got the marks and then you pick which faculty. And it was in alphabetical order. And I remember going A, nah, B, biology, nah, C, D. And it kind of got down to V, veterinary science, or Z, zoology. And I remember when I was at high school, one of the maths teachers said, oh, being a vet would be a good job. And so I thought, okay, I'll put that in vet without any idea I would get in. And from the minute I walked in the door of vet school, I loved it. It was just absolutely what I needed to do. And when I left vet school after 5 years at University of Sydney, I swore I would never darken the doorstep of another university again. Like that was just, I'm over this. So I went and traveled around the world. But before I traveled, I worked in Australia in small animal practice. Then I went to work in the UK. And while I was in the UK, I happened across Dr. Roger Mugford, who may be familiar to some people. He was a nutritionist from what I remember, but he was the one who started the head collars, the Holties and all that. Mm-hmm. And he was treating animals in one of the clinics I was working at. And I thought, oh, gee, behavior, that's an odd thing to be doing because I don't know about your education, Katrin, but in my education, behavior wasn't really animal handling, animal husbandry, that sort of stuff was covered, but not that. And I found out while I was working in the UK, because I was there for 5 years, that more animals died because of their behavior. They were euthanized than all other diseases combined. And I couldn't believe I had spent 5 years at university. I was taught how to do open heart surgery. Now, how many times have I done open heart surgery? Have you done open heart surgery? Never. And anyway, so that kind of made me think about how come I couldn't treat the vast majority of my patients. I came back to Australia and I was interested in it, but there was nobody working in behavior. And the only people who were human psychologists. So I kind of had my midlife crisis early and decided to go back to university. And I did a Bachelor of Arts with a major in psychology. And that was sort of where it started. And then I was registered as an ethologist, which not very many vets are registered ethologists, but there I was. And I started seeing cases, and I really thought, gee, I really don't know enough about this. So I pestered all the people I knew in America and went and spent time with them, and swore I would never do another exam. But I guess if you pester enough people, they embarrass you into it. And you all about that, like, oh, let me learn from you. And after a while you go, okay, now I better say I've learned something. So hence that's where, having sworn I would never darken the doorstep of another university, I went back and did a psych degree, a behavioural sciences degree with a major in psychology. And then when I started puppy preschool, I decided, well, I was telling everyone how great it was. Perhaps I'd go and better do a thesis on whether it actually helps or not. And thank goodness it did make a difference to the dogs. So that's where it all came from.
Wow, that's such a cool story. And so then, am I right in saying when you went to the US, and I believe you learned from Dr. Karen Overall and a few others, that behavior medicine in Australia was not a thing at all yet? Is that right?
Yeah, not quite. In fact, Australia, we had the first chapter in behaviour. It was called getting a membership in animal behaviour before the American College. So Australia actually was leading the way, but there was very few of us doing it. And you know, I always make the joke, if there's only one dentist in the world, we'd all have bad teeth because you couldn't go and see one person. But once the field grows and there's somebody who's doing it more frequently. So no, I actually had a membership of the Australian College, as it was known then. Now it's Australian New Zealand College in animal behaviour, before I went to spend time with Dr. Catherine Halpt, with Dr. Karen Overall, with Dr. Andrew Lucia. You know, I pestered a few people. So
all the big names in veterinary behavior medicine.
Yeah, all the big names. You know, I'm come from Australia and I'm blonde and I'm female and I need to learn. And there you go. That's how it worked.
That's
and
amazing.
Worked very well.
Yeah. And so what were the first cases that you typically saw? So are we talking like 1990s? Is that sort of the time frame that we're talking about?
Yeah, that sort of time frame, because I was seeing cases in the 1990s. I didn't become a specialist till 1999.
Yeah.
I was already seeing cases. I was already doing puppy preschool, kitten kindy. And typically the cases that came to me were dogs that bit, because that is, I guess, the first reason why someone would go, wow, I need a bit of help with this. And so they were mostly that, and probably noise phobias. I mean, I know we don't talk about noise phobia as such anymore, but the dogs who are worried about, because in Australia we have a lot of thunderstorms and fireworks and all the rest of it, and they were typically the two type of cases. Separation anxiety syndrome, yeah, I saw them too, but I'd have to say dogs who reacted to other dogs who bit people, and dogs who are worried about noises. Not many cats. That's,
Yeah.
typical, I guess.
Yeah, I mean, and even now, I mean, I think I'm quite unique in that I see a lot of cats, but even now I don't think we see as many cats as we do dogs, sadly, because I think they're the ones that oftentimes need a lot of help. And so I've obviously spent time with you in your behavior practice, which you now no longer run. So I'm very familiar with your behavior consultations as they were sort of in the last few years. But how was it sort of back when you started? Did you have a dedicated practice, or were you working out of another practice? And did you get referrals from other vets, or how did your clients come and see you? How did that all start?
Word of mouth. I owned there was a multi-person general practice. So I was a partner in the practice. So I was as a general practitioner, and then I got interested in behavior. And I was seeing cases as a general practitioner, even though I had a membership. I wasn't a specialist then, but it became increasingly difficult without setting up my own business, for the simple reason that if you're in general practice, you have 15-minute, 30-minute consults, whatever. And you know, the people would sort of come in for their vaccinations, and you do the flea spiel and you do the vaccinations and all the rest of it. And then they'd say, and by the way, doc, as they were walking out the door, and I discovered that I just couldn't actually help them with the behavior case. And it was really hard to say, well, come back and I'll do another consultation and another consultation to fit in with the 15-minute block. So I said, no, well, look, I'm just going to set a day aside. I'm still in general practice, but a day aside to see behavior cases. And I've never done social media, as you know. I'm not on Facebook or anything. And like, not all the poor kids in Australia today, they under 16s can't access social media legally anymore. But I have never done it, and I never had to. It was just sort of word of mouth. I was giving a lot of presentations. I was talking to well, anybody who'd listen, really. I was lucky I had a segment on radio, I had a segment on TV. So it just kind of grew from being around, I think. And then once the local vets heard that I was more interested in behaviour than anything else, they started sending me cases because, as you would be well aware of, there's a lot of vets, as soon as they hear behaviour, they throw their hands up in horror and go, and, you know, I've had people say to me, you spend 3 hours in a consultation? How do you do that? And so I say to the surgeons, you spend 3 hours putting a piece of bone together? How do you do that? So, you know, horses for courses, they say. So, no, it all just happened by word of mouth. And as it got busier and busier, I sold my share in the partnership and just set up a behaviour-only practice. And that's how it went.
Yeah. And did you find that both the vets as well as the pet owners, that they were looking for that service, for a behavior service, for what you had to offer? Or what was it difficult to kind of, get people to sort of accept that they needed to see a behaviorist? Because I think that's something that even today, so I have a different experience actually. So I remember saying to Teresa, who mentored me alongside you, Kersti, I remember saying to Teresa, how on earth am I going to see 400 cases for my residency? Where are these 400 cases going to come from? Like I was very kind of skeptical that I was going to get that done. But then actually, as I started to sort of offer my services and people started to know what I was offering, the cases came, which as Teresa had predicted they would, and they did. So I didn't actually find it that difficult to set up a behavior service in a brand new country, sort of a little bit like you did. Did you feel the same, or did you feel resistance? Were vets sort of saying, well, I don't know, behavior, or were owners saying, I don't know if I need that? How did you find that piece?
I don't think it was any difficulty setting it up, because once people realized that you could help them, then that was absolutely fine. I think that initially it was a bit of a novelty factor, like, oh, so you see cases with behavior problems. And it was a bit, you know, people would it was not made fun of, I can't say that, but it was sort of lighthearted. And I guess sometimes I got interviewed and well, I'm getting interviewed now, aren't I? But the people would often say, well, you know, so what do? You put animals on the couch, do you? And I'd say, well, actually, yeah, I do have a couch in one of the consulting rooms, and sometimes the dog goes on there, sometimes the people go on there. And so it was a bit lighthearted, and I think it needed to be that, just to open the door to the seriousness of it. But the cases come. I mean, I tell all my residents that don't worry about it. Once they know you're there, they will come, because people need help, and there's a lot of people who offer help, and unfortunately not all of them are professionals, and some of them are shysters, and, you know, some of them offer, you know, voodoo medicine. There's no other way to describe it. Pay a lot for this water with a tincture of this in it and it'll solve all your problems. But, you know, no, I think people who genuinely love their animals, they were willing to come. They were willing, interestingly enough, to pay for my time. And that, I think, is the hard thing, because now everybody's an expert in behavior, as you know, and they give free advice all over the place. And so sometimes people go, well, I can, you know, Dr. Google will answer that question. I said, well, fine, and see Dr. Google. And they go, well, I've tried everything on Dr. Google. I said, well, then maybe you need to come and see me, you know. So no, I don't think it was hard. I think it was just the novelty of the fact that we were helping animals with mental ill health problems, I guess.
Yeah, no, absolutely. I completely agree with you. And so in that same vein, then how did you find starting to use psychopharmacology, so behavior meds? Because a little bit like you just said about the couch, you know, oh, so you put the dog on the couch. I've heard a lot of times people saying, what, you know, you give medications or antidepressants to pets. How did you experience that, sort of starting to bring psychopharmacology into the mix and starting to use these medications? Was that something that was harder, or did you also find that quite easy to bring into your treatment plans?
No, it wasn't as hard as I thought it would be. I mean, we didn't know much about it then. I certainly didn't, to be honest. And it was a bit of, oh, well, let's see what happens. But, I guess I worked on the principle that, if the animal has an infection, you use antibiotics. If they're in pain, you use analgesics. And if we have an imbalance of neurochemicals in the brain, we have to use antidepressants. So I just explained to people right from the get-go, this was a medication. It was, a mental ill health problem is a disease. It's just like having any other physical disease, and we need to treat it, and sometimes we'll use medication, sometimes not. So it wasn't as hard. Interestingly, a lot of people, I guess, have been taking antidepressants for years, but it was humans never wanted to talk about it, it was quiet, you didn't say anything. But somehow when I start talking about it to my clients, they go, oh yeah, I've been on that, or my daughter's on that, or grandma was on that. And that opened the door, especially when they said, well, it helped a lot. So they probably wouldn't have admitted it to someone else, but because I was talking about it, we were talking about their animal, it was a lot easier to walk through that doorway because they'd already had it cracked open because they were taking them or someone they knew were taking them.
Yeah, I've had exactly the same experience. And I actually find that many clients that find me have had own personal, or like you say, family or friends related experiences with psychopharmacology. And I think sometimes those clients come and find us because actually that's maybe what is at the back of their minds that they're thinking about.
Yeah. I think that's true. I think there's a lot of because they've experienced and good and bad experiences, you would have found that too, that they're willing to give it a whirl, and that is the really most important thing. And it's I think their experiences colors the way, well, maybe color's not the right word, but influences the way that they look at things as well. And it's like you and I, if we have a bad experience with a medication your doctor's prescribed, you go, oh, do I really want to try that? But if they had a good experience, or you can explain why they might have had a bad experience and maybe their dog will be different because it's a dog or a cat. Well, dogs aren't cats, but you know what I mean. If their pet is different, they will probably be fine with that. Not everybody wants to try it, but I've had very little resistance to it when I reflect on the number of years I've been doing it, to be honest. I think it's getting easier and easier now that it's more out there. And I think now the problem is probably we're prescribing too much. That would be my experience.
Yeah, I'm with you on that one. And I think, we're prescribing some medications such as trazodone and maybe gabapentin too much. I think, on a sort of within the industry itself, vets, around the world, I think, are prescribing meds perhaps without the correct knowledge and the correct patient choice in some occasions. So yeah, it's interesting how that's kind of tipped from one way to another way a little bit. Yeah.
Well, I think if I'm honest about it, for years, I mean, I've now sold my practice and I've gone back to teaching at university because I figured that was the only way that we could get in at the grassroots with the students. However, we didn't have any medications, when I went through vet school, even when I started, fluoxetine Prozac was $100 a packet. So it wasn't going to be, the first medication of choice that you're going to give. Now everybody, it's like, oh yeah, we jokingly call it vitamin T, as trazodone before everything. I go, well, maybe we should be looking bigger picture. Do they all need it? Maybe we should be doing something else with it. And I think it's because, in general practice, you have to do something. And I talked to someone today, I was giving some lectures, and they said, oh, the dog's really anxious. They can't leave it at home. It's got separation anxiety syndrome. And what's it on? It's on fluoxetine. How long's it been on fluoxetine? 4 years. Is it getting better? I don't know. Maybe. So you can live at home? No. Okay. Well, so you have to kind of say, well, there are other medications around. Maybe we could try something else. Maybe did you do any behavior mod? Oh, no, the vet didn't know what to do about that. Well, 4 years, that's really sad from my point of view. That dog has been suffering, if you can call it that. So,
Yeah, no, I completely agree. And on that vein, just because you said that word suffering there, and because we kind of spoke about mental and emotional ill health, and I know this is something I've heard you talk so much about, Kersti, how have we managed as a profession, do you think, to see the behavioral disorders that our pets are experiencing as mental and emotional ill health disorders, as opposed to, you know, that typical being naughty or not being obedient or that sort of thing? Do you think that that perception has changed or is changing, that we're truly starting to recognize, maybe not just us as a profession, but also caregivers, that we're starting to recognize that this is truly a mental ill health disorder rather than, you know, a training or an obedience problem? Do you think that is changing sufficiently?
No, that's my honest answer. No, I think it is in some places. There's no doubt about that, but not always. People still think you can train animals out of mental ill health, and you know, I have people I know around where I used to practice go, well, you know, we run separation anxiety training classes. We train your dog out of separation anxiety. And I remember saying to one of the trainers, I said, that's fabulous. I've got a couple of diabetic dogs. Could you train them out of that too? And they looked at me like, what do you mean? No, I don't do that. And I said, well, separation anxiety is a mental ill health problem. It's due to, you know, imbalance of neurochemistry and yada, yada, yada. And, you know, why can't you then sort out the pancreas like you can sort out the brain? And they just didn't compute, you know, like, no, this is all training. It's the owner hasn't been assertive enough. I thought that had gone years ago, but it hasn't. No, I think it's changing, and I think it's changing because we've got more specialists. We have more residents. We have more people that have got more qualifications in behaviour that may not always be vets, but they may have studied, and they're starting to see the bigger picture, but not everywhere. And some people in some, you know, jurisdictions around the world, even in Australia, there are nothing but dog trainers around who still feel punishment is the way to go. And you've been a naughty dog, a bad dog, a disobedient dog. And, you know, if I just punish you enough, you'll stop doing it. And that, I think, is the sad thing. So it's changing. I thought it would, you know, like after doing this for 25 odd years, I think, oh, well, it must have changed now. And then I go back to the real world and no, it hasn't changed at all, really, because I think there's more people that own pets. There's, I think social media, like it or lump it, there's a lot of advertising goes on there and a lot of promos and influencers, and they're not necessarily doing the right thing by the animals.
Yeah. No, I 100% agree. And I'm the same. You know, I see a number of cases where the caregivers are totally on board with, you know, what we're sort of telling them, and, you know, we're making really great changes. And I think to myself, yay, we're finally, you know, we've cracked it. We're getting there. We're making a difference. And then exactly as you say, you know, you come back into the real world, quote unquote, and actually there's still so much other stuff that we don't really want to see going on. So I agree with you there. And I think, you know, I also agree that it is changing. I mean, even from when I started my residency, which wasn't that long ago, you know, in the grand scheme of things, to now, there are changes, but I think we definitely, you know, we could still see more, affect more, and so on. Yeah.
Well, it's probably no different to human with psychiatric illnesses either, when you think about it, that there's steps forward, there's steps back. I mean, when you look at the history of treating human psychiatric issues, there were places, you know, that cared for people with mental ill health, that got them working on farms and giving them physical as well as mental stimulation. They didn't use medications. Well, as far as I know, anything that we use now, probably St. John's wort and stuff like that. And then they went to a very punitive era, which is what exactly happened with dogs. Instead of being, well, let's look after them and help them and cope, they went very punitive. And, you know, there was this time, and it still horrifies me to think about this, that, you know, we veterinary behaviourists don't believe in using punishment or electric shock collars on animals, where people go, well, no, shock's the only thing that helps. But when kids were bedwetting, they had electric blankets. So if the kid bedwet, they got electric shock. And humans are like, that's horrible. And I said, well, if we did it to our kids, it's probably not surprising we thought it was okay to do it to the dogs. So there's still a bit of that around, which is a real shame, I think.
Yeah, I know. I couldn't agree more. So let's change tack a little bit, because this is also something that you've mentioned and also obviously affects me personally because I was your resident. So you've mentioned a couple of times that you do quite a lot of teaching at university level. I know you lecture all around the world, from Europe to Asia to, everywhere globally. And then you also mentor residents like myself and a number of other residents. How has the teaching piece played a part in your career, and what has that sort of brought to you, both from a personal level, but how have you been able to sort of, I guess, build your legacy and affect your career through teaching? That would really interest me as well.
A very wise person very many years ago said, teaching keeps you honest. The students ask questions that you think, I never even thought about looking at it that way, and I don't know the answer to that. I thrive on the fact that they ask me questions I don't need the answer to. I don't know the answer to. I need the answer to it, but I don't know. I think sometimes, like, I actually find school kids really interesting, because their level of knowledge, one assumes, would be low, but their level of curiosity is high. And the questions they ask are often quite unique, that you don't get from older, I guess, by people who've been at university and teaching that. But every level of teaching, I learn more, I think, than the students do. I always tell them, if they walk out with one thing they learned from me, I'm happy, because I've always already taken two things from you, because the questions they ask help me look at the world slightly differently. And you and I've had several conversations about, that I do have a different perspective on the world of animals and what's out there and what people think they know. But I think there's two reasons for that. Number one, I'm in Australia. So, here, it's from overseas, it must be good. And there's a wonderful saying that if you're 50 kilometres from home, you're an expert, but at home, nobody thinks you know anything. And I think that's probably true, because I do get asked to travel overseas and do presentations all over the world. But what it has taught me is that the animals have the same issues, and the people often deal with them similarly, not the same, similarly, because cultures are different. But you learn a lot by listening to others rather than just by opening your mouth and telling what you need to tell other people, I think. So teaching, for me, I don't know if there's a legacy. I'd like to think that maybe someone will remember me in 100 years' time. But at the end of the day, I think I benefit from the, I guess, the wonderful opportunities I've been given, because vet science gave me a whole pile of opportunities. Learning about behavior in animals and why they do what they do has been fabulous. And I guess that's why I went back and did psychology as well, because, I'm always interested in why is that happening? Why would you do that? And I think, if I'm honest about it, I enjoy the learning.
Yeah. The learning that you get through teaching, right? That if I took that correctly. Yeah. And then, Kersti, what do you think have been some of the biggest wins in, let's say, the last 10 years when it comes to veterinary behavior medicine? Where do you think, as a field, we've really been able to make a difference to the veterinary industry and the animal world as a whole? I know there have been sort of some big movements, but what are your personal favorites? What do you think's made the biggest difference?
I think, for me, the biggest difference is there's more people practicing behavioural medicine at a level that's where it should be, rather than Dr. Google answering every question. I do think that the biggest thing is that we've got more and more people in the field who have been educated properly, not just people, like, I work with some fabulous dog trainers who've got great qualifications, but there's some other trainers who just say, well, I don't need to learn anything. I've learned everything from just watching dogs. Well, some people are really good at that, but other people, they haven't watched dogs at all. They're just making a lot of money out of stuff. So I think the biggest thing is we have more vets working in the field. I think there's more acceptance that it is a science and an art, because I do think anything in medicine, regardless of the field, is a science and an art, regardless if you're a surgeon or a psychiatrist or whatever. But I think it's becoming more accepted. And the fact that it's not lumped in with welfare all the time. I think welfare is really, really important. But there's separate but similar fields, and I think the fact that we have specialties in animal welfare and specialties in behavioural medicine has probably been one of the biggest leaps forward, where people recognise it is a specialty and not everybody knows about it. And I'm sure you've had the same experience when you sit on a plane or you go somewhere and they go, oh, and so what do you do? And you say, well, I'm a veterinary psychiatrist. And they go, what? Never heard of that,
Yeah.
But the fact that it's out there now, I think that's the biggest thing, because I think there's always been good people. And if you delve back to the 1920s and even back to Roman times, the way that people trained dogs was all with positive reinforcement, using meat, things that were conducive to the dog to get him to do stuff. And I don't know where we went wrong. Probably the world wars sort of stuffed things up, I think, because we went back to punitive things. But now we're getting back to, you got to be positive about, like, bad things happen to all of us, but you don't have to use it to train people or animals.
Yeah, no, totally agree. And then where do you think the future of veterinary psychiatry lies? And actually, I'm really interested to hear you use the term veterinary psychiatry, because it's something that I also use both in my kind of media communications, and there is a lot of debate. I've had quite a lot of people come back saying we shouldn't be using the terminology of veterinary psychiatry. So I'd be interested to hear your thoughts on that, firstly. And then secondly, where do you think the future of veterinary psychiatry is going, and what do you think is next for the field?
Okay. I do think veterinary psychiatry is the appropriate name at this point of our education, I suppose, because we're not animal behaviourists or ethologists, if you look at the definition. We're psychiatrists because we're veterinarians who can prescribe medication, just like psychiatrists in the human field are doctors who can prescribe medication. We're not psychologists. We're not counsellors. That's not what we do. We actually treat mental ill health. And I do think at this time, this is the wording we should be using. Given time, who knows, we might evolve further than that, because most of our terminology comes from human medicine. And I think human medicine is changing, and there's new fields coming there all the time. What I think the breakthrough for the future will be, what I hope it will be, is that we will be able to look at animal brains, and we probably can do it before the humans do it, and see which neuroreceptors are affected. Like, we can take biopsies of most parts of the body and go, look, that's what, isn't working. We can do all sorts of tests. But now with, functional MRIs, with PET scans, with all of this study that's going on, we can probably start to look at which part of the brain is affected. And then, instead of using medications, like Dr. Carol Overall says, it's a bit like a sledgehammer, which medication do I use? Yes, it's supposed to be this works better for this and this works better for that, but we don't really know. And because it's all individual. I mean, if you've ever been ill, they prescribe an antibiotic, sometimes because they do a culture and sensitivity, but sometimes like, oh, well, it usually responds to that. But I'd like to think that we got more specific about the treatment, because if we can help animals, we can probably help humans. And I do think mental illness in humans is far more widespread than we might like to think it. And it doesn't mean it's all bad. People get very worried when they've been diagnosed with an anxiety disorder or depression, but it doesn't mean it's the end of the world. It doesn't mean that they can't function. They may not function for a while, but there are lots of things I'd like to see more done in the field of dementia, because, as you know, dogs and cats get Alzheimer-like signs and symptoms. And I'd like to think that we would help. If we can help the animals, we can help the people as well, because I think dementia is going to be a real problem. In our grandkids' time, I think it'll be horrendous. But I'd like to think that the animal world and the veterinary psychiatrists of the future are going to help resolve some of those problems.
I love that perspective. I hadn't actually even thought about it like that. But yeah, I think you're right. I think there's so much that we can do to help not only the patients that we treat, but actually looking at it from a much bigger picture point of view. And we have, seen some of the sort of first signs of what we can look at in dogs, especially like you say, around cognitive decline. dementia and Alzheimer's type signs, and how we can relate that back to then the human field. So I really love that perspective on it, and that's a very lovely message of hope to leave it on, I think. Those were all the questions I had, Kersti, when I did my little brainstorm of what are all the things I haven't asked you in the last 6 years, because you and I have had many, many great conversations. And I have to say that you have so amazingly shaped and influenced the way in which I think about veterinary behavior medicine or veterinary psychiatry and the way I practice. And it's just been an absolute honor to have been your resident. And I've just enjoyed every second of it, even though you were very reluctant to take me on at the beginning.
Well, yes. No, I mean, and to be honest, you'll have residents and you'll know they're not easy. They're not hard. I can't say you were hard work, but they are work. And one has to kind of sit back and go, But the big thing is you were a fabulous resident, and it was pleasure working with you. And I'm hoping to visit you in your practice at some stage, because that's one thing I haven't had the privilege of getting to yet. But no, and I have to say, I always call my residents flap flaps, because what I try and do is give them wings, and you've got your wings and now you're flying. And that probably gives me more pleasure than most people understand.
Oh, that's so lovely. Well, yes, you definitely have to come to Abu Dhabi. We've been talking about it for years. And the weather is yeah, exactly. The weather's absolutely gorgeous at the moment. So yeah, I mean, you're always welcome. The door is always open. But thank you so, so much for taking the time to have a chat. I think this is going to be an episode that is going to be so valuable to so many, because I don't think many of us in the veterinary industry know, the history and how we've actually gotten to where we are now in veterinary behavior medicine, and also the amazing individuals that have shaped that path and that have pioneered it and that have kind of, fought the battles for us on the front lines. And I think you are absolutely one of those people. So thank you so much for chatting to me and for sharing your thoughts and your wisdom. And I could always talk to you for hours. So it's been an absolute pleasure.
Look forward to another chat with you, and keep up the good work.
Thank you, Kersti. And thank you to everybody for tuning in. I hope you found this conversation as inspirational and interesting as I have. And I look forward to seeing everybody next week for episode 119. Bye for now.